We studied pediatric patients that had no available donors. So even that they were non-malignant disorders like bone marrow aplasia and also another bone marrow failures, we used haploidentical donors and also non-related donors. We used a platform that we use in our center using a CD45RA selection, followed by CD45RA depletion. And some patients receive donor infusions of memory T cells after the transplantation. So in these patients, we found some results that show us that perhaps the previous exposure to calcineurin inhibitors like cyclosporine, and also these patients with higher cyclosporine dose, they presented a higher rate of thrombotic microangiopathy related to transplant. So this was a 60% rate. We suspect this could be related to this previous cyclosporine exposure. Also, we found that some patients presented graft-versus-host disease. So we adjust the total dose of T cells, CD45RA. We decrease that dose in order to avoid the GVHD. So in these patients, these findings showed that this is not very easy to manage. These are not very easy to manage patients, but using this platform, perhaps adjusting the GVHD prophylaxis without cyclosporine or without any other calcineurin inhibitors, and maybe decreasing the T cell dose could help using transplantation as a possible treatment on patients with non-malignant disorders or bone marrow failure that don't have an available donor.